She arrived to us at 6:25 p.m.
And do you recall her condition when she arrived?
Yes, she was brought in by EMS. She was cold, very pale, cyanotic around the mouth. She also had various bruising all over her body as well. At that point in time, she did not have, she was in a cardiac rhythm called asystole, which means she had no pulse rate or cardiac activity at that time.
All right, so let's unpack a little bit of that. You said that she was cold. What does that tell you as a nurse working in the emergency department?
There's not a lot of circulation going on the patient.
Okay. You also said a term cyanotic. What does that mean?
It's blue in color, and it was more so around her mouth area.
And you said that you noticed various bruising?
Yes, sir.
And where did you notice that bruising?
It was on her back, kind of her lower abdomen, and I think on her thighs as well.
Okay. And was that readily apparent to you?
Yes.
Now, Ms. Bohannon, you've worked in the emergency department for about 9 years, correct?
Yes, sir.
From resuscitative methods, had you ever seen bruising like that?
No, sir.
And I'll say on a pediatric patient.
Never.
How about on any patient that you've seen?
I've never seen bruising from resuscitative efforts in my career.
Now, what was done in the emergency department?
We took over CPR from the paramedics when they brought her in. We evaluate the heart rhythm, which I said she was in asystole, which means she had no cardiac activity on the heart monitor at that time, so we continued CPR. We continued breathing for her through the ET tube that was in place by the paramedics.
So I want to show you some photographs now that my screen is up and running. I want to show you what's been previously admitted as State's Exhibit 3. Is this consistent with the way that you observed Layla when she arrived in the emergency department?
Yes.
And I'm going to show you State's Exhibit 67. Is this consistent with what you observed when Layla arrived in the emergency department?
Yes.
And you said, let's back up, have you ever seen any kind of bruising like that from resuscitative methods?
No. Never.
You said you've never seen anything close to that?
No.
Just show you State's Exhibit 52. Is this consistent with what you observed when you saw her in the emergency department?
Yes.
And I'm showing State's Exhibit 54. Is this consistent with what you observed in the emergency department?
Yes, sir.
Now, did you notice anything about her extremities?
Yes. One of her arms had a deformity, which means it's usually indicative of a break of a bone.
Okay. And if I'm showing you State's Exhibit 34, is this what you meant by deformity?
Yes.
And if there's a pointer right next to you, it's on the ledge right there. If you could just kind of point to the area where you see a deformity.
This area here, you just kind of see where it's kind of bowed out a little bit.
Now, Ms. Bohannon, did you indicate anything about this in the medical record?
I did not. We did get an X-ray
So
because we noticed it.
So you got X-rays once you noticed it, correct?
Yes, sir.
Okay. Now, how long did the ER staff work on Laila Daniel?
I'm going to refer to the record here. She arrived to us at 18:25, and we called resuscitative efforts stopped at 18:29.
So, 4 minutes?
Yes, sir.
And what happens after she was pronounced dead?
So that's when I proceed we have to call the coroner for every death in the emergency department. The coroner on call that day was Donald Cleveland, so we notified him. I also closed the room off and had a police officer stay outside the room, so no one could go in and out of the room. We also notified LifeLink, and then eventually when family members, or in this case she was a DFACS child, so you have to notify DFACS, and we also notified police as well.
You said LifeLink. What is LifeLink?
So LifeLink is an organ donation, and the state of Georgia is required to notify them for every death.
Are you familiar with the term death notification?
Yes, sir.
And what is that term?
So that's the process in which you tell the family member that the patient has died.
As a charge nurse, does that duty often fall to you?
Yes.
And did you make a death notification in this particular case?
Yes, the first person that we spoke to in this case would be Samantha White, was the defects caseworker. She arrived there first, so we discussed it. Me and Dr. Evans with her discussed that process and let her know that Layla had died.
And then what did you do after you discussed that with Miss White?
After that, I have to go back. Well, I'm also responsible for running the entire department, so there's a lot of stuff going on in that emergency room. It's very busy. So after that, I went back and we talked with the caseworkers. I talked with Donald Cleveland. So I can't remember if it was DVAC or PD asked us to also see the sister. They were going to be bringing her in as well. So I notified the minor care staff, which is the minor emergency area. I spoke with the PA and the nurses over there. I don't recall at this time who those specific individuals were, but I let them know that she would be coming in, and as soon as she got here, we would have them do a full physical assessment on them.
Okay. Did you ever do a death notification with Layla's foster parents?
Yes. When they arrived a little bit later.
And where's the death notification normally handled?
We have what's called a quiet room, so it's a room that is kind of blocked off from the public it's a quiet area where you can let the family members know what happened.
How often, as a charge nurse, do you have to do something like this?
Very frequently.
When you made the death notification to the foster parents, who were those individuals?
It was Jennifer and Joseph Rosenbaum.
And can you tell us, I guess, how you first entered the room? What you observed when you first entered the room?
When I first entered the room, as I walked into the door, there's a couch to the left. Jennifer was sitting on me facing them. She was on the left-hand side of the couch. I remember her just kind of being kind of hunched over, kind of relaxed on her elbows, kind of holding her face up. I remember her not crying at all. Joseph was sitting to her, that'd be her left, and he was sitting relaxed on the couch, kind of like this, propped up on the couch.
And you did something with your arm, just for the record. Can you kind of describe what you did with your arm?
It was kind of relaxed on the top of the couch.
And when you walked in, what happened after you first walked in?
Donald Cleveland was with me to do the death notification in this case. So at that point, we proceeded to tell them that Layla had died.
Now, prior to that, did they ask you any questions?
No. In my experience, when you typically walk into a case like that, the family member and they immediately want to know what happened. They want to see the child. They want to know what's going on. And like I said, when I first went in, they were kind of quiet and didn't really ask a lot of questions at that point in time.
Now, when you notified them that Layla had passed away, what was the response that you observed?
Joseph didn't really show a whole lot of emotion. He just kind of kept sitting there. I remember Jennifer was sitting there and she started rubbing her eyes. There wasn't any tears coming out at that point in time. She just kept saying, I can't cry anymore, I can't cry anymore.
Did this interaction seem out of the ordinary to you?
Yes.
And why is that?
In my experience, when you notify family members or anybody involved with a child especially, family members are typically, they're beside themselves, they're sobbing, they're crying, they can be angry at times, like they're just distraught. So that wasn't a typical reaction that I've seen.
To be fair, you would acknowledge that people do react differently, correct?
Yes, sir.
Did either of them say anything else to you while you were in the room?
It was kind of quiet at first, and then I asked if they had any questions, and then Jennifer proceeded to say that the child had been choking on chicken, and she tried to do the Heimlich maneuver.
Was there anything else that was said while you were in the room?
Not that I recall.
And did you stay in the room very long?
Not long, just a few minutes. It was a very busy time in the ER, and it was about to be shift change as well. So I had to get ready to get the next shift onboarded to come into work as well.
And you also mentioned that Millie was going to be checked too, correct?
Yes, sir.
Did you have any part in actually checking Millie?
I did not. The only really interaction is when they brought her in, we walked her over to the room that she would be evaluated in.
So did you ever see or observe Millie yourself?
No, I did not.
Nothing further this time.
Ms. Hall.
Did you give a statement to police about the way Joseph and Jennifer were sitting?
No, I did not.
And in fact, you don't know whether they had been told about the death before or not?
No, ma'am, I did not.
And you do not know whether they were in shock or not?
No, ma'am.
So they could very well have been in shock and not showing the kind of emotion you described?
It's possible.
You got the child with a towel, a shirt? What came with the child?
Usually they're typically exposed, which means they don't really have any clothing or anything on them.
But did they come off of the gurney with a towel or a shirt?
I do not recall that.
Thank you.
All right, thank you, Mayor. You can step down, and we're excused unless there's an objection. And the state's no objection for being excused.
Right, that's right. Raise your right hand, please. One. Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Put your hand down. You can take a seat. And please state your true and correct name for the record.
It's Charles Evans.
Okay. And sir, how are you currently employed?
I work at Pt.1 Henry Emergency Department. Been there for 17 years.
And what do you do at Pt.1 Henry Emergency Department?
I'm an emergency physician.
Can you tell us a little bit about your education? Where did you get your, where did you graduate from medical school?
So I went to West Georgia, graduated there in 92, went to, graduated Medical College of Georgia in Augusta in 98, finished residency in 02, and then went to Piedmont Henry July of 02, been there ever since.
Okay. And in the practice of emergency medicine, do you also see pediatric patients?
Yes.
All right. And are you trained in that in your residency?
Yes.
Is it common for you to treat children around the age of 2 years old?
Yes.
I want to direct your attention to November 17th of 2015. Do you recall treating a patient by the name of Laila Daniel on that day?
Yes.
And do you recall the reason why she came into the emergency department?
Cardiac arrest.
And when she arrived, what were your initial observations when she arrived?
Lifeless child, CPR in progress, intubated, had the tube down the throat, being breathed for, and no response.
When you say lifeless, was she dead when she arrived to you?
Yes.
Did you learn about any resuscitative methods that had been attempted in the field?
Yes. Paramedics give a report when they come in and tell us what they did and what they told us. Essentially,
It's an exception to hearsay for purpose of medical treatment.
what were we talking?
You can continue.
So they give a report what they did. ACLS protocols followed. Intubated child, did CPR. Multiple rounds of epinephrine with no response. I think the record shows greater than 30 minutes. Resuscitative efforts with no response.
Okay. And you said greater than 30 minutes. Why is that important?
Well, if you're down for any significant time with no response, then you're not coming back. In a normal situation, unless you're hypothermic, cold water submersion, that's really the only excuse on that.
Did you do anything in the ER when she arrived? Any sort of resuscitative methods?
Well, when they move over to the table, we continue CPR, doing the manual compressions, breathing for the child, kind of reassess everything to look to see if we have any activity on the monitor that we could possibly do anything about. I'd have to look at the record and see. I mean, there may have been one epinephrine given, but it was really a futile effort. There was nothing to do.
Okay. You mentioned that the child they were doing CPR. How would you do CPR on a child that was Layla's size?
Yeah. I mean, you can use your palm and you use 3 fingers. You just wouldn't have 2 hands pushing on it. So either way is acceptable.
Either way is acceptable.
Either one.
Now, we've all seen the medical shows where doctors are able to defibrillate someone back to life. Given the heart rhythm or lack of heart rhythm that Layla had, would that have been an option for you?
No.
And why is that?
There's no irregular rhythm to correct. So you're correcting it with electricity. You're not creating one.
Now, you mentioned that the child was intubated, correct?
Yes.
Meaning that you were doing manual breathing for her?
Yes, the paramedic had put the ET tube down and they were breathing for the child.
Now, how long did it take before you called the time of death in this case? And you can look at the record.
Yeah, I'd have to look. Said the code was called at 1829, which is 629. Let's see if I can compare it when they came in.
Does about 4 minutes sound about right?
In that scenario, that would sound right. I just got to the trip report yet, so.
Okay. All right. So about 4 minutes that she was worked in the ER before death was called. Is that correct?
I would agree with that.
Now, when you observed Layla's body, did you have any other concerns other than the cardiac arrest that caused her death?
Yes.
What was the concern?
Diffuse bruising.
And what do you mean by diffuse?
From what I remember, upper chest, pelvis. And then, when we moved her over, you noticed the back, kind of just top to bottom bruising.
We'll start first with stage 52. It's behind you. Is that what you recall observing?
Yes.
All right. And that's we're looking here at her abdominal area, correct? And stage 57. Is this what you remember observing on her back?
Yes.
If you had to give us an approximate number, how many patients do you think you've treated in your emergency room career?
Over 100,000.
And in the over 100,000 patients that you've treated, have you ever seen anything like the bruising you saw related to resuscitative methods?
No.
Specifically the Heimlich maneuver?
No.
Specifically CPR?
No.
Now, was there any concern about the location of some of the bruises?
Yes.
And what stood out to you as far as the location of some of the bruises?
Well, it's just odd location. I mean, a child was going to get bruises and bony prominences. They fall, they hit their elbow, they hit their knee, they bump their forehead. They don't really hit the pelvis very good. They don't hit flat on their back and get multiple bruises on their back, or their neck. It was an odd appearance, didn't look right.
Now, did you examine her extremities?
Yes. It may not have been a great detailed exam, but it was a cursory exam because obviously something went right, and I felt like we were going to get some detectives involved. So, I let them do their job. I kind of just do the medical. Okay. So, yes.
Now, when you examined her extremities, did you notice anything unusual about any of her extremities?
Yeah, I mean, there was bowing to the left arm, from what I remember.
And I'm going to show you Exhibit 34. We're looking at her left arm here, correct?
Yeah, right.
And do you see what you meant by bowing?
Yes.
And can you take the pointer to show us what you mean by the bowing? And did that appear unusual to you?
Yes.
Now, did you do anything? Did you order any additional testing?
After the code was called, I was alarmed at the presentation, the context of what was going on, and I felt like there was something not right. So I ordered a bone survey, take a picture, kind of the entire baby to look to see if there's old fractures of different ages of healing, with suspected abuse. That's what I thought.
So because of the suspicions that you had, you ordered a full body skeletal X-ray, correct?
Yes.
All right. And do you recall the result of that particular X-ray?
I'd have to look, but I do remember there was a mid-shaft ulnar fracture, with had not healed with a callus around it. That one stood out to me. Now the lower leg, I can't remember. I'd have to look at that. But when I see the left arm in the context, we call that a nightstick fracture.
What do you call it a nightstick fracture?
Because you walk a nightstick, usually an adult. I mean, that area is usually from the defensive posturing,
I'm going to show you stage 130. And is this the ulnar fracture that we're looking at?
Right.
And how old? Let me ask you this: what do you see when you look at it?
Well, you see the fracture segment and a little bit of a callus around it, which at earliest that'll form is 5 to 7 days. Latest you'll get about 14 days. So it varies. I mean, that could be 3-4 weeks.
So, when looking at that, you think that would probably be around 3 to 4 weeks old?
Could be easily.
Would this kind of fracture be painful?
Oh, yes.
Now, did you, you mentioned that you let the police do their job. After ordering these x-rays, did you have any other further treatment of Laila Daniel?
No.
Nothing further.
Thank you. Ross.
Good morning, Doctor. My name's Kareem Mull. I just have a number of questions, nothing much.
Yes, ma'am.
I just wanted to check with you and see if you confirm that, in fact, you found her to be well-nourished. Isn't that correct?
Yeah, grossly, she didn't look cachectic.
What
She didn't look grossly malnourished.
Okay,
I mean, it's a general appearance.
And in fact, what you wrote was that she appears well-nourished, correct?
Yes.
And every child is different, isn't that correct? And every
Sure.
child heals and reacts to injury differently, correct?
They can, yeah, sure.
And what takes 3 to 4 weeks in one child may take longer in another child, correct?
Maybe. I mean, if they have osteogenesis imperfecta or something such as that, but general children heal about the same. That's why you go to ortho and they say it'll be 6 weeks.
Okay. But that's still an estimate.
Sure.
You have children that are outliers, don't you?
I'm
In
sure
every
they
field.
exist, yeah.
Now, you were not told about the CPR and Heimlich maneuver efforts that were made by Jennifer Rosenbaum, were you?
I don't know if they said CPR was in progress when we arrived or not. That was minutia to me at the time.
So you don't know what she had done prior to EMS coming? Nobody told you?
Not specifically, no.
Nobody told you anything about the way she did CPR?
No.
Nobody told you about the way she did the Heimlich maneuver?
No.
Thank you, doctor. That's all I have.
All right, thank you, doctor.
Thank you.
Any objections for this being excused?
Not missing.
And you're free to go. State will call the next witness.
State will call Detective Harris.
Detective Harris. Back here, please. And Ms. Young will swear you in.
Sir, can you please raise your right hand? Do you swear affirm the testimony you're about to give should be the truth and the whole truth so help you God?
I do.
Please lower your hand and state and spell your first and last name.
My name is Dwayne Harrison, DWA-YNE-H-A-R-I-S-O-N,
And Detective Harrison, how are you employed?
with Henry County Police Department.
And how long have you been with Henry County Police Department?
6 years.
And what are your duties with the Henry County Police Department?
I'm currently assigned as a sergeant in the Criminal Investigation Division.
And how long have you been assigned as a sergeant in the criminal division investigation?
Almost 2 years.
And in 2015, where were you assigned?
I was assigned to the Criminal Investigation Division at that time.
And you talk really fast.
I'm sorry.
I actually slow down just a little bit. In 2015, what were your duties?
I was a detective.
What were your duties as a detective?
The way the Henry County Police Department Criminal Investigation Division is set up is we're called general detectives, so we investigate any crimes that come through. We have a specialized unit, but for the most part, any crime that comes through from theft to a crimes against person, we do felony case, we investigate those cases.
And did that include suspicious deaths of children?
Yes, we investigate all deaths. That's part of my job.
And on November the 17th of 2015, did you get a call in regards to a suspicious death?
I did.
And who did you get that call from?
Sergeant James Peden.
And when you got that call, what did you do?
I responded myself and Detective Poliski responded to Henry Piedmont Hospital, reference to a death of a 2-year-old child.
What information did you have prior to going to Henry Piedmont?
Just that a 2-year-old was transported to Henry Piedmont and it died later on at the hospital.
And at what did you arrive at Henry Piedmont?
I did.
And upon your arrival, what did you do?
When I arrived, as I stated, I was advised that Laila Daniel had been transported to Henry Piedmont by the Henry County Fire Department in reference to a call they responded to for child choking. So while at the hospital, Layla died while being treated at the hospital.
And did you have an opportunity to observe Layla when you arrived at the hospital?
I did. She was in a treatment room, an emergency room. She was laying on the table. I observed bruising on her arms, her abdomen, and her forehead.
At any point, did you look at the back of Layla?
I did not.
Upon seeing the bruising that you talked about, you said on her head. What's the market states exhibit 14 and previously admitted to evidence spectrum for light speeds? Are you able to see the bruising that you observed on her that day?
I believe so. It looks like a bruising on her. Looks like I'm looking at the picture right on the right eye that I'm looking at.
And then states exhibit number 5. Do you recognize that?
Yeah, that's see more of that forehead with the bruising.
And there's a pointer right there in front of you. If you could use it to point, I believe it has a blue handle right there.
Just right here?
Yes, sir.
You see bruising on the forehead.
Did you notice bruising anywhere else on her facial area?
as you can see, she has her face covered up and obviously blood around her nose. That's most of the bruising I noticed was on the forehead.
And you said on her arm as well?
Yes, ma'am.
Which arm was it that you observed the bruising?
Not sure if it was both or one.
I'm sure you states, what's been marked in State's Exhibit number 38. Is that the bruising that you're talking about?
Yes, ma'am. You can clearly see all the bruising on the arms.
Showing you what's been marked in State's Exhibit number 34. Did you observe this arm?
Yes, ma'am. It appears to be her left arm, bruising on it as well.
After observing Layla and these bruises, what did you do?
At that point,
Actually, were you given any additional information in regards to her injuries?
again, I was told that the injuries appeared to be suspicious. I also met with the ER doctor who showed me an x-ray of an arm. I believe it was a left arm that had been broken previously and had not been treated properly or healed properly.
After getting that information, what do you do next as part of your investigation?
When I arrived, Sergeant Peden was already on scene, Detective Mahar was on scene, Coroner Donald Cleveland was on scene, crime scene technician Michelle Johnson was on scene, and defects worker Ms. Carr was on scene.
At this point, did you have any information about whose care Layla was in at the time that she was brought into Piedmont Henry?
I was told at that time when I met with Sergeant Peden that
He's saying you have a hearsay on hearsay.
At some point, did you have information as to how Layla arrived to Piedmont Henry? Or whose care she was in prior to coming here?
I did.
Well, again, let's just ask you for hearsay.
That particular question did not go. So overruled as to that question.
You can answer.
Well,
Let
you
me
have to
ask
stay away
you-
from statements.
Let me ask you, do you know who brought, or who was in Layla, whose care Layla was in prior to her coming to Piedmont Henry?
I was told.
Did you have any contact with individuals in regards to being primary caregivers of Layla Daniel?
I did.
Who did you come in contact, or who did you contact as being primary caregivers of Layla Daniel?
Anytime someone dies, we do what's called a notification. Once it was determined that obviously Layla died, myself, Coroner Donald Cleveland, who normally goes with us when we do notifications, along with Ms. Carr, went to a waiting room where the Rosenbaums were in at the hospital to meet with them, to explain to them that Layla had died.
And who did you meet with?
In the room was Jennifer Rosenbaum, Joseph Rosenbaum, Mary Rosenbaum, Jennifer Marie Rosenbaum, and an unknown male was in the waiting room.
What happened once y'all got into the waiting room?
We went in. Jennifer explained that they were the foster parents of both Layla and her sister Millie.
And what was it, at that point had you made the death notification?
No, we had to make the death notification at that point. We were told that, or by Jennifer, that they were,
I think you were told by who?
by Jennifer that a
The
defect.
defendant?
Yes, ma'am.
Okay.
That,
Overruled.
You can continue.
I was told by Jennifer that a Miss White, who works for defects, had already told them that Layla died, so they were already aware that she died.
What was their demeanor when you came into the room? Let's start with Joseph Rosenbaum.
Joseph was sitting, there was a couch. Henry Piedmont used to have what they call a quiet room. It's a waiting room where it's a more private area. But there's a couch in there, and Joseph was sitting on the couch. I believe he had his arm around Jennifer, who was sitting, I think, to his right.
And what was his demeanor?
They were just both sitting there. They didn't appear, abnormal to me at that time.
Did you observe them crying at all?
I didn't observe anyone crying at that point, but I said that they'd already were aware that Layla died, so it wasn't like we told her they were just finding out the news.
And at that time, what did you do besides making the death notification while you were in the room?
We kind of started asking preliminary questions of what had happened at that point.
And who were you talking to when you asked what happened?
Both Jennifer and Joseph.
Did anyone respond?
Mostly Jennifer did the talking.
And what, if anything, did she tell you?
Jennifer told me that, again, that she and Joseph were the foster parents of Layla and Millie, and they just got foster care custody of them in July of the year, of 2015. Jennifer said that Joseph keeps the kids during the daytime. She keeps them during the evenings, so Joseph works during the day. So she's only home during the day, evenings, he's home during the day.
At any point, did they indicate anyone else who would care for the children?
They did at that time.
And did you ask them any additional questions?
Jennifer said on this particular day, Layla was in her high chair eating. Jennifer told me that Layla had been sick previously with some congestion and had just started eating solid foods in the last couple of days. But this day she was eating chicken tenders that,
Let me ask you something. When she was was telling you about Layla being congested and not eating well, did she ever mention having taken her to the hospital or the doctor as a result of her not feeling well a few days prior?
She didn't at that point. We didn't ask her. She did. She just said she had some congestion.
At that point, was there any indication as to where Joseph Rosenbaum was during the time?
Didn't which time?
During the time that they were up feeding the child on November 17, 2015?
Jennifer was at home alone at the time that the children were eating. Joseph said he had gone to work at, I believe, 4:30 p.m. that afternoon. Left him in the care of Jennifer.
And you said that she was feeding. You can continue. What else? What did she tell you about where they were, what they were eating?
Again, Layla was in a high chair, eating chicken tenders. I think she said carrots and some yogurt. She was helping Millie put her shoes on because I think they were going somewhere that night, I'm not sure. She said she looked back and saw Layla kind of moving back and forth in the chair. She went over to check on her, thought she may be choking, took her out of the high chair, performed a Heimlich maneuver on her. She then took her over to the sink and started hitting her on her back. She said she hit her hard. Then she took and...
I'm going to stop you right there. When she said she did the Heimlich maneuver, did she indicate to you whether or not anything was dislodged?
She didn't. That's why she said she struck her in the back.
And did she tell you how many times she struck her in the back?
She didn't.
Did she tell you where she was when she began to strike her on the back?
They were by the sink.
Did she tell you at that time whether or not anything was dislodged when she struck her on the back?
It wasn't.
Did she tell you what else she may have done to try to get it dislodged?
She did. She said at that point she tried using her finger to dislodge whatever was choking Layla, and also she used a butter knife to try to dislodge what was in the choking Layla.
Did she tell you when she used her fingers to sweep to dislodge whatever she was choking on? Did she tell you if anything came out?
She didn't.
Did she tell you when she put the butter knife in there to attempt to dislodge or see what was in there if anything came out?
She didn't.
Did she tell you she took any other measures to try to get whatever was allegedly in Layla's throat out?
No, she said after doing those type things, she's already at the sink, so she took the faucet and tried to give Layla water using the faucet. That didn't work either.
And did she tell you what other measures she took trying to get something out of, allegedly get something out of her throat?
After that point, she said during the whole thing, Layla was kicking. So at some point, she dropped Layla from about 1 to 2 feet off the ground. Once on the ground, she said she tried to perform CPR on Layla.
At that time, did she tell you about whether or not she moved Layla anywhere from out of the kitchen area?
She did.
Did she say when she dropped her on the floor, did she immediately do CPR? Or did she say she moved somewhere else?
Yeah, I don't recall that.
If she had told you that, would you have notated that in your report if she had moved her somewhere else?
I would have.
And I'm going to show you, looking at your report will help refresh your recollection.
Sure. Yes, in the report I stated that's being dropped 1 to 2 feet is when she actually started performing CPR.
So did she tell you that she moved her from the kitchen area to the living room area?
That, again, she didn't tell me that, and I didn't notate it in my report.
Did she tell you whether or not she gave Layla CPR?
She did.
Did you ask her about, did she tell you anything about her knowledge about CPR?
She did. She was asked how she learned CPR, and she said she learned it when she was 16 in foster care.
Did she ever mention the fact that she was in the military as a military police?
She didn't at that time, though.
After her going through those steps, what's the next thing, if anything, that she said to you?
After that point, she said that
Let me ask you this question. Did she tell you if she saw anything come out of Layla's mouth?
she never mentioned anything to me of anything coming out of her mouth, and I don't recall her saying anything ever coming out.
Okay. Did she tell you any other steps that she took at that point?
The question was asked to her, when did Layla stop breathing? Because as she stated previously that Layla was kicking during this time. She didn't really answer that question. She just said that she was still kicking, at which time Jennifer, used her body, arms and legs to pin Layla on the floor to prevent her from kicking.
Did she describe how she pinned her on the floor?
She just said using her arms and legs, she pinned her, using the word pinned.
And did she tell you what happened when she had Layla pinned down on the floor?
She didn't.
What did she tell you happened next?
Next, she said she contacted 911. 911 told her when she made contact 911 is to say now every time Layla would take a breath. And at some point, the ambulance did arrive and took Layla to the hospital.
Did you ask her anything because you indicated that you knew that Layla had some broken limbs at that time? Did you inquire of Ms. Rosenbaum about those broken limbs?
I did ask Ms. Rosenbaum about Layla having a broken leg, which time she stated that they had noticed that Layla had been limping. Took her to Children's Health Care. They did an x-ray, found out her leg had been broken. She said that the leg was broken during gymnastics when she was on some type of bars.
At this time, time, is Mr. Joseph Rosenbaum there?
Yes, ma'am, he was there all the time.
And do you ask any questions of him?
The only thing, Mr. Rosenbaum elaborated on the fact of what he did when he was with the kids earlier that day. The fact that the children woke up from nap, he got them up, took Layla to potty, and then he left around 16 or 4:30 p.m. to go to work.
So at 4:30 p.m., according to Mr. Rosenbaum, were the girls up?
They were up then when he left.
And Layla was on the potty, or she had gone to the potty?
She had gone to the potty.
She had gone to the potty. Did you have any more conversation with the Rosenbaums after that?
At that point, we had just scheduled later on to meet to discuss this further.
Did you have any further involvement in this case after that, after your activities on the 17th?
My involvement in this case after that was limited to a support role.
Never further at this time.
Okay, thank you. Cross.
Jeff Harris, you've been a detective for how long?
I've been a police officer for 16 years. I've been a detective for probably approximately 7 of those years.
7 of those years.
Yes,
And how many death notifications have you done?
Numerous, I don't have a number.
And isn't it true that everybody reacts to death differently?
Yes, ma'am.
And isn't it true that Jennifer told you that she was trying Heimlich, she was trying sweeping the finger into the mouth, and then Layla dropped to the floor, correct?
At some point, Layla did go to the floor, correct?
And she tried to give Layla CPR right then.
That's correct.
But she said she didn't know how to correctly do it. She did it as best she could.
Yes, ma'am.
And it's your testimony that you, this was all conducted at the hospital.
Yes, ma'am.
You, thank you. I have nothing further at this time.
You're right.
Did she say Layla dropped to the floor, or she dropped Layla on the floor?
She said she dropped Layla on the floor.
Thank you.
Anything else?
Nothing further from the state.
Okay, thank you, sir. Took you to step down, and you're excused. Unless there's no objection.
No.
It's witness be excused.
Yes, Your Honor.
Okay, we'll call this next witness.
Julie Espinoza.
Right through that gate in front of you, ma'am, and then all the way around here to the witness.
Good morning.
If you could please raise your right hand. Do you swear from the testimony you're about to give, you the truth and whole truth so help you God?
I do.
Please lower your hand and state your true and correct legal name and spell it as well.
Julie Jean Espinosa.
If you could please spell it.
Julie. Middle initial Jean, Jean. Last name is ESP as in Peter, IN as in November, OSA.
And Ms. Espinoza, how are you employed, ma'am?
I am a staff nurse in the emergency department at Pt.1 Hospital.
And how long have you been employed at Piedmont Hospital?
I've been there since May 1st, 2010.
And what are your duties at the hospital?
Currently, my duties are I work as a staff nurse in the emergency department, so I take care of all age groups in emergency care, including the very sickest to the not so sick. I also serve in some educational capacity. I teach some of our staff nurses different programs that we have through our association.
Have you had any special training in regards to pediatrics and small children?
Yes, ma'am. We all have to have a certification called Pediatric Advanced Life Support, which
And I'm going to ask you to slow down because you speak really fast.
Sorry. We all have to have a certification, which is called Pediatric Advanced Life Support. That's through the American Heart Association. I also teach that program. In addition to that, I also teach, and I'm an affiliate faculty for a program through the Emergency Nurses Association. It's called the Emergency Nurses for Pediatrics course. And that's strongly encouraged by our management teams. And as I said, I teach and I'm faculty for that program as well.
And how long have you been on faculty for that program?
About 2 years now.
And over the course of your career, about how many children have you treated involving traumatic injuries?
More than I'd like to say. More than 50.
And let me ask you, were you on staff at Piedmont on November 17th, 2015?
On that particular date, my title at that time was clinical educator, but yes, I was helping with staffing on that date.
At some point during that time, did you come into contact with the victim, in this case, Laila Daniel, and her sister in the place?
Yes, I did.
Let's talk about your interaction with Laila Daniel. How did you come into contact with Laila Daniel?
After the initial event, my shift had pretty much ended, and I was checking out with the charge nurse when I encountered another child that looked very much like Layla.
Well, I'm going to ask you about Layla first. What was your interaction with Layla?
Layla, we had gotten a call that we were to expect a child that was in cardiac arrest, and the report was the child had been choking on some food. So I was asked to assist with that. So when they arrived, EMS brought her in. When they arrived, they had been doing CPR on her and their own ACLS PALS protocol for about 30 minutes prior to arrival. She never had a pulse. They had gotten her intubated. They had gotten an advanced airway in her, and they had given her several cardiac drugs with no response. So we switched her over to our room, our bed, our monitor. She was still in asystole, and at
Let
that...
me ask you something right there. When you get the call that you have a 2-year-old child coming in that's choking, what preparations do you take in order to prepare for treatment of her?
For that, we re-prep the rooms. Our rooms are pretty much ready for an adult population, but we bring in something called a pediatric resuscitation cart, and that has all the equipment and supplies that we need for a child anywhere from the age of a newborn up until about 40 kilograms, so which is usually about an 8-year-old. Okay. Also, our pharmacist gets involved, and they would bring in and help us with drug calculation because it's very different for a child. We administer drugs by dose, the dose by weight. And in a pediatric arrest, we might not necessarily get the most accurate weight, so we have another system that we use, which is called the Broslow tape, that helps us to do that. But the pharmacist would also help us. So there's a lot of people that come in, we would call respiratory, who bring their own equipment that is specially sized, just in case we don't have an airway, so that they would also be able to do their special stuff. And of course, the physician is notified, and we're all notified what to expect.
And so were y'all prepared and ready when Layla arrived?
Yes, very much.
What happened when she arrived? You talked about y'all switching over monitors. Are you switching over everything from the EMTs to the hospital?
When they arrived, they were doing CPR, giving breaths, and doing chest compressions. And at the same time, we have kind of a moment of silence while all this activity is going on. And they were giving a report to the staff, myself, and the physician, of course, Dr. Evans. But we are physically moving her onto our bed, getting her sized up, and putting her on our monitors to see what we can see for her. So that...
Let me ask you that were performing CPR on her.
Yes.
How did they appear to you?
Tired.
Have you ever had to perform CPR?
Yes, ma'am.
What does that do to the person's body that's performing CPR?
It's very taxing, especially in their situation. It's a very intense process. We always say you can get 30 minutes of cardio and 5 minutes of CPR. Because you're bending over, you're pushing as hard as you can, you have to maintain a certain rate. You need to make sure that you're also coordinating with whoever's got the airway to make sure they're getting the breaths in. So it can be very intense. So they look tired, but they were performing chest compressions I checked for a little bit of a pulse to see. Sometimes you'll have what we call, it's not really a pulse, but with the chest compressions, the heart is being compressed, and so the blood is being circulated a little bit, and so you can feel a little kind of a pulse.
Let me ask you, because what you just described as far as the person that's performing CPR and I guess what it takes from their body, is there a protocol about how long someone should perform CPR?
Yeah, there is a standard. American Heart recommends that we switch every 2 minutes. And usually the switch is from whoever's giving breaths to chest compressions. So you swap every 2 to 5 minutes. And there's also a protocol because sometimes we get a little bit caught up. And the next thing that we would do is we would use other measurement guides to kind of tell us how effective your CPR is. And one of them would be checking for that pulse to see if you're feeling that when they do pressures.
And did you do that with Layla?
Yeah.
And were you able to see a pulse?
I felt one. I felt one.
Okay. After feeling that pulse, what are the next steps that you take as far as treatment for her?
And it's really guided by what the physician wants at that point. But we would move her, switch over the monitors and everything like that. And as soon as we got her on our monitors and everything going, we would ask them to stop chest compression so that we could check for an actual pulse being generated by the heart, just like all of ours is generating one right now, I hope.
And were you able to find the pulse once the chest compressions were stopped?
No.
Do you guys continue treatment on Layla?
At that point, we were all ready to continue, but we did a quick review. Dr. Evans did a quick review of all that had been done in the field, and he had already done kind of a heads-up eyeball, and we opted to discontinue our efforts at that point.
And when you say discontinue, Dr. Evans called time of death?
He did.
After the time of death is called, what do you do next?
For my aspect, I start to do my survey. So I start looking at the patient, seeing what's there, what's not there, what's in place, kind of what needs to be done next. And then also making sure that our documentation pieces are started.
With a child that has been choking, what types of outward signs would you be looking for?
And it all depends, but really I'd be looking for a dirty airway, food or vomitus or something in or around the mouth, because a lot of times when you do CPR, that will happen. And I would be looking for kind of that more bluish discoloration in her face, maybe some hemorrhages in her eyes, depending on how long or what she was choking on. Because when you say choking, there's really two types of choking. There's that manual strangulation, and then there's also the foreign body in the airway. So you would be looking for things like that. And you look for bruising. With kids, one of the big things that I have always learned and always taught with kids are born healthy. So when their pulse all of a sudden stops and you're doing CPR on them, you want to know why. So you start looking.
I want to back up. So the signs that you would have been looking for was, I guess you said vomit or food or something like that in her earway.
Somewhere.
Did you find any of that with Layla Daniel?
No, she was clean.
And I think the next thing you said was the coloration of her face. What type of coloration would you be looking for?
I'd be expecting something a little bit more blue.
Okay. And did you see that with Layla Daniel?
She was very pale.
And you indicated that you also were looking in her eyes for hemorrhaging.
Yeah.
And I'm going to show you what's in Marshall State's Exhibit number 15. Is that Layla's eye that we're looking at?
Yes, ma'am.
That hemorrhaging that you would find that would be consistent with choking, did you find it here?
No, ma'am.
And this is State's number 16. Did you check both of her eyes?
I did.
Okay, did you see any of that hemorrhaging that you discussed?
No, ma'am.
And then you said you would check for bruising.
Yes.
Because you didn't have a pulse. And showing you this Marshall State's Exhibit number 13. Is this what you observed when you saw her?
Yes, ma'am.
And what, in your medical opinion, was that consistent with a child who had been choking on a piece of chicken?
No, ma'am.
I said,
Question again?
my question was, in your experience as a nurse, have you ever seen bruises like that in a child that's consistent with a child who had been choking?
No, ma'am.
What other, did you observe any other injuries on Layla?
There was some additional bruising, especially on the side that I had noticed on her flank area.
I can't hear what area of the body you see.
The flank.
Okay.
So basically, the lower back, this area right here.
Okay.
And I also noted some stuff that was on her face.
Show you what's in Marshall State's Exhibit number 10. Did you know anything that you noticed here?
Yes, ma'am.
And if there's a pointer right there, if you could utilize it, has that blue handle on it. And if you could show us what area of bruising you were talking about in regards to her face.
Well, specifically this, and as you go through the pictures, there's also some bruising on her forehead, or right near the scale point, I think it was.
I'm showing you State's Exhibit number
Yes, ma'am.
12. Is that what you're talking about?
Yes.
And in State's Exhibit number 9. And if I could get the lights, please.
Yeah,
Thank
that a
you.
little bit. Thank you. Yeah, so you can see like a really strange pattern right here.
And then State's Exhibit number 14. And did you notice bruising? Any other bruising on Layla? You talked about her face.
And her flank, the back of it.
Showing you State's Exhibit number 67. Are those injuries that you observed on Layla's black area?
Yes, ma'am.
State's Exhibit 32. Where are the bruises in State's Exhibit 52?
You can see right here, here, right down.
Now, those bruises that you observed, were any of those in your training experience consistent with signs of a child who had been choking or shaking?
No.
And State's Exhibit number 69. Where is this bruise here on her body?
It's on her buttock, on her left cheek.
When she came in, how was she clothed?
She had on the diaper, the pull-up.
So was this bruise underneath that pull-up?
Yes, ma'am. That's.
And did you at that time have any history about what resuscitative methods had been taken?
Yes,
You
we
can have it.
we were aware. The paramedics had told us of what efforts they had made, and then there was some discussion, and I'm not too sure how that information was shared, but that CPR was.
Was it a discussion with the EMTs?
EMTs, yeah.
Are you receiving this information in regards to medical treatment for Layla?
Yes, they had stated that they had been given pre-arrival instructions on CPR, apparently.
Have you, in your career, dealt with patients that have had a layperson perform CPR on them?
Yes, ma'am.
In the course of your career, have you ever seen anyone with the extensive bruising that Layla had as a result of a layperson performing CPR on them?
No, ma'am.
Have you ever had contact with someone who had the Heimlich maneuver performed on them?
Yes, ma'am.
And by a layperson?
Yes, ma'am.
In your experience, have you ever seen anyone with those types of bruising as a result of a layperson performing the Heimlich maneuver on them?
No, ma'am.
After anything else that you noticed about Layla, or anything else that you did at that point, once you guys had gone over her body?
One of the big things that I noted as we went through was the different colors of the bruises. As anyone knows that's had a bruise or who's gotten hit by something at first.
I would object on testimony. It's medical testimony. It's not, she's not an expert. And bruises can't be dated according to medical science. I'm sorry, that's not going to that. I would object.
Response.
I was asking her experience, Judge, has she seen individuals that reported bruises on their body that happened at different times?
Yes, yes.
And did you?
1 second, please. Don't believe this is beyond the camera thing. We're here for, and I'll allow this.
And in that experience, when you've had someone report about bruises that occurred at different times, did they appear different to the naked eye?
Yes, ma'am.
And what would be the difference in those, what you saw with your naked eye?
Just like anyone who's ever noticed, if you've ever had a bruise on yourself or your loved one, initially when you get the initial injury, it's usually kind of red. And after a little while, it'll turn a little blue purpley. And then after a little while longer, it starts to heal in the tissue underneath. It starts turning brown and then yellow and then disappears. And so that takes a long time. If you've ever had a bruise, you kind of know what that looks like.
So let me ask you, in State's Exhibit number 67, '69. In your observation, did the bruises appear to be different colors?
Yes, ma'am.
Okay. Did that give you cause for concern?
Yes, ma'am.
Why?
Especially in the same area, you would expect that tells me that this definitely all didn't occur within the same time frame, within the same day period. Anything that happened to her that day would have expected to be a little bit more reddish, and a lot of those were more of the blue, brown, yellow colors for a few days out.
As a nurse, do you know how your body works and how a bruise occurs?
Yes, ma'am.
What has to happen with your body in order for you to get a bruise?
You have to have great circulation in your tissue. You must have that peripheral perfusion that's going to wipe the blood cells in and out. When you initially get injured, the little vessels break. That's what causes the bruising. And when those vessels break, they bleed for a little while, and that's what makes it red and then blue. But as they start to heal, they take that same dirty blood or healing blood and they take it back into circulation, and then that's where you see the colors dissipate. But all that time, your heart has to be working in order for that perfusion and that healing to happen. So that is...
Did Layla have good circulation when she showed up at the hospital on November 17th?
No, ma'am.
Was her heart beating?
No, ma'am.
To your knowledge, upon EMT had her heart, was her heart beating when they arrived?
No, ma'am.
Besides the bruising, was there any other notations that you made in regards to Layla Daniel?
Multiple stages of bruising, multiple areas of the body. We had also noted she had had a skeletal survey done, which I do believe Dr. Evans could speak to a little bit better, which is because of our concern for what we visually saw, we went ahead and started that protocol, so to speak. And looking at those x-rays, we also saw similar injuries.
X-rays at this point. She's not a radiologist.
Did you look at her x-rays,
I did.
Mr. Noza? Have you looked at x-rays in the course of your career as a nurse?
23 years, yes.
Are you able to read an x-ray?
With some confidence.
Did you look at those x-rays?
I
Just
did.
take a check.
After, were you in the room when the x-rays were done?
Yes.
After they're done with the x-rays, is there anything else that you do in regards to Layla Daniel's treatment?
I think at that point, we notified the authorities who were there very shortly, within a few moments, to let them know our concerns and also assist them with the initial connection of, or handoff, I should say, of forensic evidence.
Did you do anything else in regards to Layla Daniel?
No, none of that.
Did you, at that point, I think earlier you started telling me about Millie Place. Did you have an interaction with Millie Place?
I did.
Can you tell me how that came about?
I was supposed to be going home. That was the end of my shift. And I kind of whipped around the corner to let the charge nurse know where we were in the room as far as the handoff. When I came around the corner, I was kind of surprised to see there was another child there. We don't usually actually learned in that area, and that child looked amazingly similar to Layla. So
What did you do upon seeing Millie place?
kind of froze. Sarah, the charge nurse, Sarah Bohannon had let me know this is Millie's sister. This is Layla's sister, Millie, so that, we all kind of knew to kind of guard what we said. And she let me know that she was having some issues. They needed to do a physical exam. So I kind of sat with Millie for a moment to find out what was going on until we could take that over, because Sarah had some other responsibilities as well. After we had arranged how that was going to happen, I actually escorted Millie back to the room where she was going to be examined by our provider, as well as the investigators, I believe, from defects.
And did you examine Millie while she was at the Miami?
I did.
Okay. And what did you observe during the examination of Millie?
She had some bruising, but nowhere as extensive as Layla, but she did have some bruising. She was very conversational, very talkative young lady, so we did have a great conversation about a lot of stuff. But she did say some things to us at that point, which I think the investigators have noted, that of course was a concern to me.
What did Millie say to you?
Millie had told me that Layla had been asleep for a while before everyone came. I know the investigators were trying to figure out a time.
Well, not speculating what Layla told you. After Millie told you that Layla had been asleep for a while, did she tell you anything else?
Everything after that was very circumspect. We kind of discussed what the activities of the previous day was and how they had been going to gymnastic classes. And I asked her to explain to me, she had a lot of bruises on her legs that I noticed, and I asked her to kind of explain to me how it happened, what happened. And she did explain that she had been tripped and she had fallen and that she had been to gymnastic classes for the different bruises.
So, I just want to be clear, she said she'd fallen, some of them.
Yeah, she could tell me, like, okay, this is when, that is when. I'm like, okay.
Did you have any interaction with the defendants, Joseph Rosenbaum, on that day or any day?
No, ma'am.
Did you know or know who they are?
No, ma'am.
In the course of your career, in regards to the injuries that you saw on Layla, where would it rank as the worst?
It's the second.
Nothing.
Good morning, Ms. Espinoza. My name is Courtroom Trials. I just have some questions for you. Did the paramedics tell you that they had seen vomitus on her lips?
No.
So you weren't made aware of that?
No.
And how long have you been a nurse?
I've been a nurse since 2007. I've been a paramedic since 1996.
So you've been a nurse 12 years?
Yes, ma'am.
And with regards to the heart beating, you don't know what the conditions were at the house, whether or not the heart was beating at that time, do you?
No, ma'am. All I know is what the paramedics' report was when they arrived.
Isn't it true you talked to DFACS and told them that CPR would not or cause these injuries on the body if the Heimlich maneuver or the CPR was done correctly? Do you recall saying that to DFACS?
Not that verbiage.
Well, let's take it piece by piece. Do you recall reporting that if done correctly, the Heimlich maneuver and the CPR could not cause the injuries?
It wouldn't if CPR and Heimlich were done correctly.
But if it were done incorrectly, there's no telling what could have happened. Isn't that correct?
Sure.
Thank you. That's all I have.
If done incorrectly, would you expect to see injuries on the neck?
Your Honor, I think she's asking to speculate if then, that's speculation. It's what you expect to see is every child is different, every person is different.
All right.
Thank you, Judge.
Thank you.
Even if done incorrectly,
Right.
in your experience, would you expect to find injuries on the victim's neck?
Absolutely not. And if I were allowed to explain.
Please do.
A Heimlich maneuver, even when you teach to a layperson or you give instructions over the phone, which in my career I have done phone instructions in EMS, you would instruct the person to place their hands above the navel and below that chest bone, below there. So if it were done incorrectly, I would never expect to see anything on the neck.
If done incorrectly, you expect to see it down there on the pelvis area.
Not there either.
If done incorrectly, I want to be sure we're talking about the Heimlich and the CPR.
CPR, same, similar instructions. If they were receiving dispatch instructions, the instructions would be to place the hand over the middle of the chest, between the nipples, on the breastbone. So even if they were doing it incorrectly, you know, to have the hand placement down by the hips, that would be really off the mark of instructions.
And if you could use that corner that's in front of you.
So if I were,
Be careful.
if I were getting anyone instructions over the phone or, you know, even in a class, I would tell them basically to put their hands in between the nipple line, right here on the breastbone. So I might expect to see some redness or bruising anywhere along here, right?
And do you see any redness or bruising along there?
No.
And let me ask you, someone received CPR training when they were 16. Would they have some, would they be, during the class, if I could finish my question?
Let me see. What is your objection?
Speculation, Your Honor.
She's the type of objector she wants, number one. Number two, I didn't hear the last part because of the corner.
If I can ask my question again. Let me ask you, you've taught CPR classes?
I've been an instructor for the American Heart Association since 1998.
And when you teach those CPR classes, are they the same? Is there training for everyone that's basic and standard across the board for CPR?
Yes, especially when it comes to hand placement.
Where is hand placement in general taught for CPR classes to place your hands?
Since 1998, it's always been in the chest.
Oh, thank you. Yes. And I was asking you, consistent. These injuries here, what area of the body are we looking here? And I can bring it up to you,
Yeah,
let's give you some more information.
Point? I'm not 100% sure.
And I'll take it back. Does that give you some orientation?
Yeah. All right,
So what area of the body are we looking at here?
that would be the inner thigh.
And if CPR is being performed or Heimlich incorrectly, would you expect to see injuries here in the inner thigh area?
No.
And here, what area of the body are we looking at here?
Lower abdomen, pelvis, and also the groin.
And was that groin area when she arrived, was that area covered?
This area here, of course, was partially covered by the little pull-up, but this is part of what I had seen initially.
Would you, CPR Heimlich performed incorrectly, would you expect to find bruises in the groin area or the pelvis area as indicated in State 52
No.
and State 67?
No.
Why not?
The chest compressions or compressions should be centered in the thoracic area. So incorrect hand placement, hands can bump from the left side to the right side, it can go a little bit lower. You might see some bruising going down the lower chest area. At multiple different occasions since 1998, we've changed hand placement from, you know, the middle to the lower third to the 2/3. It's been all over the place. It's always been in the chest. Never down, never will we give anybody instructions to do compressions down here. And in cardiac arrest, there's such poor perfusion, obviously, because the heart is not beating. I mean, the bruising that you would get would be in the most immediate area of hand placement.
Nothing further.
You've been telling us now about how instructions are given, correct? And that instructions are given to put the hand between the two nipples.
Mm-hmm.
And everything you've told us is instructions according to the American Heart Association.
Correct.
But if, in fact, you have somebody that is not being told how to do it and is doing their own CPR, their own Heimlich maneuver, there may be several ways of doing it incorrectly. Isn't that true?
It is true. It is true from their own interpretation, but I've never seen a TV show or anything else that did chest compressions anywhere but on the chest.
I understand that, but with regards to what happened in the house prior to the paramedics coming, you were not given any information as to that. So you don't know about the fact that she was pressed up trying to get the child to spit out the food. You don't know any of that, do you? And so you have no knowledge of what happened prior to the paramedics coming. Nobody discussed that with you.
I
You
was
didn't
not on
talk to
scene, and that was not part of our report.
And so you don't know what kind of chest compressions were given, what kind of Heimlich was given, what kind of pounding on the back was given? You don't know that, do you?
Would not know.
Thank you.
Anything else, Ms. Young?
Nothing further.
All right, thank you. Thank you, ma'am. You can step down.
Thank you.
Any objection to the witness being excused?
Nothing to say, Lord.
All right, and you're excused.
Will you the truth, the whole truth, and nothing but the truth, so help you God?
I swear.
Put your hand down. Please state your true and correct name for the record.
Joseph James Mahar.
And how are you currently employed?
I'm a detective with Henry County Police Department.
How long have you been a detective in the Henry County Police Department?
A little over 4 years.
And how long have you been with the Henry County Police
Over
Department?
7 years.
And in 2015, what was your assignment?
General crimes.
What did you do as a general crimes detective with the Henry County Police Department?
We worked all aspects of criminal investigations. We worked property crimes, personal injury, whatever came across our desk, whether we were responding to or assigned.
And I'm going to go ahead and bring you back to November 17th of 2015. Do you recall responding to a case on that particular day?
Yes.
And what was the nature of the call that you received?
It was a infant death call.
And when you responded, or when you got the call, where did you respond to?
I responded to Piedmont Henry Hospital.
What, if anything, did you do while you were at Piedmont Henry Hospital?
I met with the shift supervisor, not on call, but the sergeant on shift at that time. Spoke with him about the case, and then got my, well, what do you want to do next?
Okay, and what were your assignments related to this investigation?
After going up there and making contact with him, we just decided that we were going to do a search warrant at the location, the residence.
Okay. And when you do a search warrant at the location, was anyone, to your knowledge, was anyone at the location at that point?
As far as?
A police officer.
I believe the officer left once the ambulance left.
And did you do anything to have someone from your department go back to the home?
Yes, once we determined that we were going to do a search warrant for the residence, we sent the patrol officer back to the location, a secure location.
Okay. And do you recall the address of the residence that you searched?
Yes.
And what was that address?
1521 Lincoln Terrace, McDonough, Georgia, 30252.
And were you present during the search of that particular home?
Yes.
And was anyone else present for that search?
Yes.
Other officers?
Yes.
How about the defendants?
Yes.
Where were the defendants when the Henry County Police was? Well, first let me ask you this: did you get a search warrant for the home?
Yes, one was obtained.
And did you execute that search warrant?
Yes, I did.
What day did you execute that search warrant?
Same day.
So November 17th of 2015.
Yes.
Okay. And you said the defendants were present. Where were the defendants located?
They were inside the foyer in like a little, I guess, sitting area or small room inside the foyer to the right.
And was anyone with them?
Yes, the patrol officer.
Were they allowed to walk around the home during the execution of the search warrant?
No, they were not.
And why is that?
For security of evidence.
What was the purpose of you all responding to that location that evening with the search warrant?
Suspicious natures of the possible cause of death or injury to the child.
And were photographs taken?
Yes.
And were you present on scene when these photographs were taken?
Some of them, yes.
I want to show you what's been marked as states 234 through 301. Your Honor, with the exception of, there will be no 247 or 251. I'm going to show you 234 through 301 and ask you if you recognize these particular photographs. Do you recognize those photographs?
Yes.
What do you recognize them to be?
Photographs of the exterior of the house and then the interior of the house.
And do they fairly and accurately represent what you observed during the execution of the search warrant on November 17th of 2015?
Yes.
Have there been any modifications, alterations, or deletions to any of these photographs?
Not that I can tell.
Your Honor, at this time I move to admit states 234 through 302.
Admit.
I'm sorry, through 301. Judge Maher, I'm going to want to go through with you some of these, and if we got the lights come down, some of the photographs that you can turn around. What are we looking at in states 234?
It's a chair next to the table with a booster seat chair, so to speak, or booster seat chair, so to speak, where you'd place a child to eat.
Based upon the information that you had when you were executing the search warrant, why was this photograph of interest?
The call out was reference to the child asphyxiating on food, and this is where she was sitting while she was eating.
States 235, what are we looking at here?
Same chair, just a little closer up.
And states 236?
Overall shot of the general area where the chair associated with the table and the kitchen and the plate.
Now you mentioned the plate. What are we looking at in 237?
That is the plate where the suspected chicken or the chicken nugget was.
So you had information regarding a chicken nugget or chicken tender?
Right, the original statement was that she was choking on a piece of chicken or a chicken nugget.
I want to show you 238. What are we looking at in 238?
A close-up picture of the plate and the chicken.
What are we looking at in 240?
It's a different angle of the table and what was on the table.
And is this just another angle in 241?
Yes.
Another angle in 242?
Yes.
Where is the high chair in this particular photo?
It would be behind the table in the back corner. You see the corner of the blue part of the, yes.
This right here?
Yes, that'd be the top part of the chair.
In 243.
It's a overall picture of the floor where there was some clear fluid on the floor.
And the high chair is where?
To the right, you can see the orange and the blue on the right-hand side, upper hand corner.
Right there?
Yes.
And 244?
That is the back door open with the, I guess, the dog gate in place, because I guess the back porch.
Now what are we looking at in states 245?
There'd be a closer up image of the fluid on the floor.
Now why did you take this particular photo? Or why was this photo taken, I should say?
Reference to the choking statements. We believed it was spit up or bile from choking on the chicken from the child.
And to your knowledge, was anything swabbed or taken from this area?
Yes.
Showing you 246. What is this?
It's just a even closer up image of the fluid.
Now, in 249, what are we looking at here?
Looks like the crime scene text evidence marker, and I believe it should be the same fluid.
Sure. Why did the crime scene tech put down an evidence marker?
The crime scene tech originally will do overalls of the entire scene, and then later she will take more photographs with markers to show what evidence to collect it from.
Okay. I'm going to show you 248. What are we looking at in 248?
Same picture. I believe there was 2 spots of possible fluid on the floor. One with evidence marker 1, one is evidence marker 2.
Okay. And so 250, we see evidence marker 1, correct?
Yes.
And is this was any kind of sample taken from this particular evidence?
I believe so, yes.
In 242, are we just looking at what are we looking at here?
A different fluid spot.
I want to show you what's been admitted as State's Exhibit 253. What are we looking at in 253?
The sink and the kitchen counter.
Okay, if we were standing here in the kitchen, where would the high chair be in relation to where we're looking?
You'd be it's kind of an angle, so you'd be facing, the kitchen sink would be to the left in this image, and then to your right hand side in the other direction would be the kitchen table and the high chair.
And is this another photograph of the kitchen?
Yes.
Now, did you take any photographs from the inside of the sink? Or any photographs taken of the inside of the sink?
Yes.
All right. I'm going to show you what's been admitted as State's 255. What are we looking at 255?
The sink and the contents.
And 256?
Close up of the sink and the contents, and the markers reference to the butter knife.
Now, was there ever any evidentiary value in the butter knife?
Not that I had personal knowledge of.
Not that you had personal knowledge of? Do you know if the knife was ever collected?
Yes, the knife was collected.
Okay. And do you recall why the knife was collected?
Statements reference to the butter knife being used to clear the obstruction from the child's throat.
In State's 257, what are we looking at here?
That's just a close up of the knife.
And are we also looking at the plate?
I believe so, possibly the little pieces on the plate. But I think mostly it was for the knife.
Now, were the pieces on the plate, were those collected for evidence?
No, they were not.
And why is that?
Food would deteriorate, rot, and biodegrade.
We're looking at stage 258.
It's the opposite side of the kitchen.
And 259?
Just another overall shot of the kitchen dining area.
And is this kind of, just to reorient us, is this the high chair we were talking about previously?
Yes, and the kitchen sink would be directly 90 degrees to the left.
Stage 260. Where are we looking at here in stage 260?
It's a close-up of a child's spoon and looks like a napkin.
And stage 261, can you see kind of where that spoon is located in this more wide-angle view?
Yes.
All right, and is this it?
Yes.
Now, did you also take some photographs from the exterior of the home?
Yes.
Were they taken that night?
Yes.
I'm going to show you 262. What are we looking at in stage 262?
It would be the right side of the home. If you're facing the front of the house, it would be the right side of the home.
Okay. How about stage 263?
Looks like more of a straight-on angle of that same side.
264.
The fence and a gate into the fence.
How about stage 265?
This will be facing the front of the house. Will be the left side of the house.
So this is the other side of the other side of their yard?
Yes.
And then 266.
The front angle and a picture of the window.
Now, did you also get photographs from other areas of the interior of the home?
Yes. Overall, photographs of the entire interior of the house were taken.
We'll go through some of those with you. This is stage 267. What is 267?
It's a photo of just inside the foyer, looking straight into the house.
How about 268?
That would be, I guess, the living room, common area,
And 269?
a close-up of an end table in the living room.
Stage 270.
Another angle of the living room focusing on the couch and coffee table.
And stage 271?
Different angle, same room.
Now, what I'm pointing to right here, what is that right there?
Those are stairs because it's the living room recesses down from the main foyer.
Is that a high distance?
Or sorry, that's the kitchen.
That's the kitchen?
Yeah, because you're looking at the couch is up against the wall, coffee table, and to the right of this image would be the linoleum for the kitchen. So it's a step up to the kitchen.
How about 272?
It's from the living room area shooting towards the kitchen.
And the stairs that we were just looking at, where would they be located?
To the left of that chair and the big chair on the left side of the picture.
Stage 273 is another angle of the living room?
Yes.
What are we looking at 274?
This is, as soon as you walk in the main entrance, there's, I guess, like a official dining area set up to the left of the foyer. This is from that area shooting to the right where the Rosenbaums were sitting.
And stage 275?
The other door from that room shooting towards the living room.
And 276?
Kitchen area and part of the living room.
So we just kind of come full circle at this point?
Some of the first floor.
277, what is that?
The stairs leading to the second floor.
Okay. And what is this that's on the stairs?
Carpeting.
278?
Upstairs hallway.
Do you recall what we were looking at in stage 279?
Appears to be the master bedroom.
280?
The same master bedroom.
Did you take several photographs from the interior of the master bedroom?
Yes.
We were looking at 281.
The right side, facing the foot of the bed, the right side of the bed and master bedroom.
I'm going to skip over to 284. What are we looking at here?
Part of the headboard / nightstand, whatever you want to call it, and the contents on it.
And is this also that same part of the bed?
Yes.
And this is the contents, correct?
Yes.
Now that kind of white bottle where the label isn't facing us, was a photograph taken of that particular bottle?
Yes.
What are we looking at page 286?
That bottle.
And what is that bottle?
That's icy hot pain relief.
What are we looking at 287?
Upstairs bathroom.
And in stage 288?
The same bathroom, focusing on the counter.
All right. Is there another room that you also took photographs in upstairs?
Yes.
What are we looking at 289?
It's a small, I don't really call it a room, but it's part of the master bedroom. It's just a set-aside area, I guess. It's all open, there's no doorway, it's just one big open room.
So this is kind of in the master bedroom but set aside?
Yes.
And what are we looking at here?
Small love seat with blankets and other items.
Now, was that the same room that we were looking at in States 289?
As far as the master bedroom?
Yes. Is this the same room?
Yes,
289?
yes.
Okay. 291?
A close-up of the love seat.
292?
It's a close-up of the blankets and the love seat.
And were some of these items that we're looking at collected?
Yes.
All right. And what items were collected?
I believe we took the baby or the child's blanket, would appear to be child's blanket. And I'm not going to recall if we took the large brown one or not.
In States 293, what are we looking at?
Different angle of that adjoining room.
Okay. Now, was anything found in this particular room that you took into evidence?
Yes.
I want to show you States 294. What are we looking at in States 294?
You can't tell from here, but it was a small tube of pain ointment.
Okay. Showing you States 295. Is this the photograph of that ointment?
Yes.
And what does it say on there?
Pain relief, muscle pain, and stiffness.
What else?
Arnicare gel. Let's see, quickly absorbed, unscented, non-greasy. I can't quite make out the other ones.
But at the top, you said
yeah, muscle pain, stiffness, swelling from injuries and bruising.
States 296. What is this room?
The child's room. Or excuse me, the children's room.
What do we see in States 297?
A close-up of I guess their desk area.
And over here, what are these things over here?
Look like toys or books or storage area.
Okay. How about States 298? What are we looking at in States 298?
Different angle of the kids' room, toys and play items and whatnot.
States 299?
Same room. I want to say it's possibly the closet.
Okay. And over here, these are the toys that you were talking about?
Yes.
And they have more toys over here?
Yes.
Now, when you are done with a search warrant, do you leave any sort of paperwork for the residents of the home?
Yes. There's a property and evidence sheet that's filled out. It has the items notarized, or not notarized, but the items listed on that sheet. Then a copy is left with the homeowner or resident.
Okay. And States 300, is that what we're looking at here?
Yes, they documented that a copy was left behind.
And States 301, is that what we're looking at here?
Yes.
So it's 300 and 301, these were all the items that were taken from the home, is that correct?
Yes.
You mentioned some you mentioned that there were some things that were collected as items of evidence, is that correct?
Yes.
I want to show you what has been previously marked as States Exhibit 302 for identification purposes. Do you recognize States 302?
No, I see it just. Yes, it's one of our markers and evidence.
And was this an item? Were these items of evidence that were collected by you during the search of this home?
The crime scene tech actually collected, but I was present when they were collected.
Okay, and were they placed into this bag?
Yes.
Were they sealed?
Yes.
And is that common procedure?
Yes.
Why is it common procedure to seal the bag?
Chain of custody and confirm there's no tampering with evidence.
Okay. And these were the items that were taken from the house that night.
Yes, some of the beddings and blankets and towel.
So yeah, tell us what items are in here.
It should be a piece of bedding/blanket, another bedding, blanket, and a towel.
And were these some of the items that we saw when we went through all the crime scene photographs?
Yes.
Your Honor, I move into evidence States 302.
No objection.
Let's leave this up here with you for right now, okay?
Okay.
Now, you mentioned that there were some swabs that were taken from some of the areas in the home, correct?
Yes.
And I think that was markers 1 and 2.
Yes.
All right. I'm going to show you what's been previously marked as States Exhibit 304. Do you recognize States 304?
Yes, it's an evidence bag. Markers are swabs.
And you said swabs?
Yes.
Okay. And were those the swabs that were taken from the scene?
I believe so. Without seeing the other stuff, yes.
Okay. And were you present on scene when these swabs were taken?
Yes.
And they were taken of those photographs that we saw previously?
The clear fluid, yes.
Your Honor, I move into evidence States 305.
4.
Oh, sorry, 304.
Three reports submitted.
Thank you. Now, you also mentioned that there was a gel that was taken. We saw that just very recently in States 295, correct?
Yes.
I'm going to show you what's been previously marked as States 305 for identification purposes. Do you recognize States 305?
Yes.
And what do you recognize it to be?
The item description being of that container of gel ointment.
And was this something that was collected at the scene on that particular night?
Yes.
Okay. And was it placed into an evidence bag?
Yes.
Was it sealed?
Yes.
Your Honor, at this time I would move to admit State's Exhibit 305.
Submitted 305.
Can you go ahead and open that particular item? And if you can show it to the jury. You can put it back in the bag. Okay. Thank you. I'm going to show you what you previously marked as States 303. You recognize States 303.
Yes, it's going to be the knife from the kitchen.
And I'm going to put up onto the screen States Exhibit 256. Is this the same knife that we are talking about?
Yes.
And was that knife collected on November 17th of 2015?
Yes.
Was it placed into an evidence bag?
Yes.
And was it sealed?
Yes.
Your Honor, at this time I would move to admit States 303 into evidence.
No objection.
Admitted.
Do you know if any further testing was done on that knife by the GBI?
After the fact.
Obviously, not that night, correct?
Yeah, no tests were conducted that night.
And part of the reason why you collect evidence is to potentially do some further testing. Is that correct?
Yes.
And would that be correct for States 303, the knife, and States 304, the swags?
Yes.
Now, did you have any other role in this particular investigation?
Neighborhood canvas afterwards, but other than that, no.
And what do you
No
mean? Sorry, what do you mean by neighborhood canvas?
We're assigned to walk around the neighborhood, talk to the neighbors, see if they heard, seen, or saw anything.
Okay. And did you collect any statements from talking to any neighbors?
No.
Nothing further.
Thank you. Cross.
We have a minute. Detective Marr, my name's Kareem Mall. I have a number of questions for you. Please let me know if I don't speak loud enough. I wanted to talk to you about living room pictures. In the living room pictures, did you take, were the pictures taken, everything was intact or had it been moved around?
The photographs were taken when we executed the search warrant, so nobody was in there.
Okay. Let me show you what's been marked as States Exhibit 271 and ask you to identify what this is a picture of.
The living room and coffee table.
Now, were any of these items collected? The towels, the pants, another towel, any of that collected?
I don't recall.
You don't know or you don't recall?
I don't recall.
As far as you know, they were not, correct?
I don't recall if they were collected or not.
You don't have them, do you?
I didn't. Personally, no, I don't.
You didn't put them into evidence, did you?
That would be the crime scene tech. If she did or did not.
Okay. Let me show you what's been marked as 300 and 301 and ask you, do those items appear on that list?
It's kind of difficult to read with the way the picture is and broadcasted. Do we have the originals? I can look at the originals and tell you.
Certainly. Let me show you what I've marked as, what's been marked as 300 and 301 and see if you can identify